would you agree that the Dengvaxia controversy had a significant contribution in the downtrend in the vaccination in the Philippines?
Yes,
Kasi,
especially the Dengvaxia scare.
kasi the London School of Hygiene noted significant drops in the confidence of vaccines. In 2015, 93% of the respondents, 82% of respondents thought that vaccines were safe. By 2018, in the Philippines, it was at 21% na lang. Ang laki ng bagsak eh.
Yes, yes. I agree that the vaccine scare actually created a huge loss of trust in the vaccines. But let me put it this way. It was specifically because they were relating the dengue vaccine plus the deaths. It was so, it was a picture of mothers crying, their children dying, and somebody who was pretending to be an expert going out and putting blood in his hands, wiping on the white. It was the scare that was created. And we were very candid and frank in saying, please stop this.
My understanding was that the last time we heard from Sanofi Pasteur, what they were saying was that those exposed to Dengvaxia who were seronegative or who have never had dengue before are at greater risk or have great risk of developing severe dengue.
Okay, let me recap the full statement. The initial statement said, in our monitoring, using another test that we have discovered, we found out that it's very effective for all patients up to the 3 years. After the 3rd year, it's still very good for the seropositive. However, for those who are seronegative or hindi ka pa nagka-dengue, 0.02% of them will have the possibility of developing severe dengue in its old definition. And then they further defined it, it simply means plus 1 day of hospitalization.
So you're saying the first 3 years,
The
whether
first
you were
3
seronegative
years
or
or
seropositive,
positive, you're highly protected.
so you're not at risk of
No,
severe dengue?
no.
Okay,
Kaya,
I just like that kasi the impression I got, and I think the impression that most people got, was that pag seronegative ka, ibig sabihin hindi ka pa nagkaka-dengue, high risk ka talaga from the very start of severe dengue. Pag,
the
naturukan ka.
problem was, it was released online in France, and a few doctors who have been campaigning against vaccines, against cervical cancer vaccine, against tetanus vaccine, got it and read portions of it. So if you look at the official statement, and even if you look at the WHO declaration, the vaccine is very effective for the first 3 years for all.
For all?
Yes. And they said, we have developed a new testing kit with the University of Pennsylvania, I think, with UPenn. I'm not sure. It's University of Pittsburgh. We have developed a new kit with the University of Pittsburgh that will soon be in mass production in 1 to 2 years. Because on the 3rd year, those who are seronegative will have a reducing effect, reducing protection of the vaccine. Ibig sabihin nun, because I have training in vaccinology, my understanding there is that they will test all those who are vaccinated. If you're seronegative, then you will be given a booster dose. That's the probability.
A booster dose.
Yes.
You will need a booster dose.
That's my understanding on vaccinology.
This is something new for us.
So you're saying yung mga naturukan nung 2015,
seronegative.
2016, walang problema yon for the next 3 years?
Yes. And that's
Kahit
contained,
seronegative.
yes.
Okay,
because
so this is new.
ang lumalabas, kasi that was the exact declaration, kaya lang, nagkaroon na ng scare,
natin nalaman.
hindi na kami, you look at the declaration,
We
it's
thought
there.
all the seronegative persons who received the vaccine
It
are
actually
in trouble.
says, if you look at even if you look at the laymanized WHO statement, kasi nilinaw na ng WHO, first 3 years, it's protective for all. However, on the 3rd year, there is a weaning off of the protective effect on the seronegative.
They will need a booster
less
shot.
protection.
Yes,
Kumbaga,
less bumababa,
humihina yung protection sa'yo.
And it said, so the possibility of severe dengue will happen in the 0.02%. But they said, if you compare the seropositives, the protection given to the whole population.
For 3 years.
Hindi, ito. First 3 years, protective sa lahat. Ngayon, on the 3rd year,
Yung
bababa.
seronegative.
However, this will happen, the severe dengue, on the 0.02%. At sa ngayon, wala pang testing kit ang pwedeng gamitin. So if a country has a huge endemicity, which was defined as more than 80% incidence of dengue, yung zero prevalence, Pilipinas kasi 93%. Kung marami na ang kinagat ng lamok at nagka-dengue sa Pilipinas, it's more beneficial to vaccinate the population dahil yung seronegative are mostly below 9 years old, yung mga baby. Kasi mas baby ka, mas konti pa ang probability na nakagat ka ng lamok. Pero kung titingnan mo at pinagpatuloy mo yung pagbabakuna, you have the other good effects, which is 93% reduction of severity, 80% reduction of hospitalization. Kaya maraming pasyenteng mababawas. Kung meron mang seronegative na nabakunahan, it will entail additional 1 day in the hospital.
From your point of view, should we continue, pursue, put back the vaccination of
Yes and no. If you look at the guidelines, we really fit into a public immunization. However, with the current trend na ang dami ng takot, there are cases na ito namatay, ito ganito, mas maigi ng wag muna para hindi sila matakot kasi pinipilit mo. However, come to think about it, dengue vaccine is in the EML list, the essential medicines list. What does it mean? It means this is the list of medicines that the world is mandating and obliging each government to have. Ibig sabihin, dapat binabalik siya ng Pilipinas
siya.
even for the private market.
In hindsight, would you have done something differently in administering dengue vaccine?
Okay, let me put it this way. I'm the Secretary of Health.
Yeah.
You abide by the vaccination program that the World Health Organization and each country decides on. So there's actually a 5-year plan. When I joined the Department of Health, dengue vaccine was already on the pipeline, but it didn't have CPR permit and no budget. So whatever is the recommendation of the experts, I will follow suit. Because even now, if you look at the results of Brazil, 0 deaths, 90% reduction in incidence of dengue after their public immunization program.